So, medical legal aspect of death. What is death first? What is death?
Station of life.
Cessation of life. How would you say that the life stop?
Then no.
Give me the medical term. You're doctors already. What's the medical term? Again? Okay. Respiration cessation, also known as the heart is not beating, is also known as cardiac arrest. And how about the breathing? Cessation of breathing means also known as in medicine. Cessation of breathing is
No.
ah. So in short, that is you said it already ago. Give me the medical term
Cardiac and respiratory.
or cardiorespiratory arrest. So please, you have finished forensic with when you finish forensic with me. I don't want to read or see in the death certificate cause of death, cardiorespiratory arrest, because that's the definition of death, not the cause of death. Okay? Unless you can prove me something that someone died, their heart is still beating, and they are still breathing. That's the time that I will change my mind. Have you seen some death certificate written there? Cardiorespiratory arrest.
No, it's
Yes. A lot, right?
cardiac.
Cardiopulmonary arrest, cardiorespiratory arrest. Both of them are just
Yeah.
the definition of death. Am I right? Correct me if I'm wrong. Are you sure? What are the classifications of death? Somatic, cellular. What's the difference between the two? So somatic is external, cellular is internal. Metabolic, yes. Now, what is the implication of death from a medical legal perspective? Anyone? Implication of death. That's the old version. Okay, that's one. Pathological or it was caused by someone external. Am I right? So, in short, why do we need to know how a person died? We discussed this last Wednesday, right? Yes, we discussed this last Wednesday. Good. Foul play or suicide. Again, murder.
Homicide.
What's the difference between a homicide, infanticide, parricide, genocide?
Homicide. Singular. Genocide. No.
For example, let's just say you were walking. I am walking on a street, then or my group was walking in the street, then there were three drug addicts attack us, and all of us died. What's that? Can you say that's murder? Can you say that that is a murder?
Manslaughter.
Huh?
Manslaughter.
They attack us and all of us died. Can you say that's murder? Anyone? Why the sudden quietness? A quiet room makes me sleepy. Anyone? Yes or no? Is that a murder? Let's start from Aman. Yes or no? Yes? Yes or no? We died by the attack of the three drug addicts. Is that murder? No. Yes or no? Yes. Yes. No. If your answer is no, stand up. 1, 2, 3, 4, 5. I'm very sorry to those who answered yes. The answer is no. As I told you, murder can only be proven in court. That's homicide. Even there's actually yes, even if there's a lot, that's homicide. Unless you kill the clan, that's genocide. You kill an infant, infanticide. Now, what is a parricide? What is a parricide? What is a parricide? That's insecticide. What is parricide? Why am I standing and just moving in circles? Because you like the only. No, I'm looking if you have phones with your using. And this is fiber, this is off, this is off, this is off. Why not use your phone to see what's parricide? Rule number one, during the first day, I told you you can use your phone, right? Make sure that your answer is correct. But you cannot use your phone or your AI. There's exam. What is parasite?
Parasite is a living organism that lives in a host, a living organism that occupies in a host and takes
Parasite. Parricide.
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 Hindi ka best feeling of a parent and brother.
Countryside, countryside.
Who's watching anime? Who's watching anime? It's only the example for the insight of using as the anime.
Which one?
Naruto. Naruto. Ah,
It's quite famous now.
yes, but did you know that I have regrets when I finish Naruto? The bottom line of Naruto, Naruto is gay. Why? Naruto is being chased by a girl, but Naruto is chasing a boy. Yes.
Oh my god.
And everyone hates me when I said that. But yes, if you watch Naruto, you'll learn that when you finish it. Okay, let's go back. Naruto. Anyone who knows Naruto, how would I give you an example? Genocide.
We are just imagine. Genocide.
I know. What's the other one? Yes, genocide. Talk about Auschwitz. I don't know if Gladiator is genocide. The one in the family of
Yeah, it's my family.
yes, it's the family that
That's bad. No.
Gladiator is genocide also. But the best example for genocide is the family of Itachi in Nami. Itachi killed his own clan, all 100 plus.
Actually, that's too much.
No, Itachi is in the clan. He killed his
So genocide, killing of our Jews,
clan.
the nation.
Yes, something like that.
Oh, it's nation, just.
A village wherein the whole family is there. That's genocide.
What if the father shoots the wife and the children?
It's a big kind of
It's not wrong.
that's homicide. It's more on the family. I forgot the term. That's why I stopped. I really didn't introduce the term because I just forgot.
It's known as kinslaying.
Yes, but there's one term.
It's another term.
One word.
Killing of a sibling is fratricide.
Satisfied, yes.
Fratricide is oh my god, I should choose one. I got some authorities.
I will look for
Family
that.
side.
There, I can.
Family side.
Family side. Family side.
If you just murder one's wife, that's you oh my god, you prophesy. Resourcide. 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 Homicide, matricide.
What do you want to refer to side?
Awesome.
Side. Sorry. I was asking him, what do you call if you burn the side family? What do you call when you burn the side family? Side burns. So implication. So what are the manners of death again? Natural, accident, suicide.
Homicide. And unknown.
Unknown and undetermined.
Undetermined.
So when they ask you for the manner of death, those are the manner of death. I hope you know how to define it. So death and dying are encountered by most healthcare professionals. Have you been in the hospital? Have you encountered death?
Yeah.
Have you encountered a dying patient?
Yeah.
What happened to the dying patient?
That's wrong. And then
So in short, you did not revive it.
we did. Try our best. We did CPR. We intubated, but
Yeah, you're zero out of. You mentioned me a while ago. You're zero out of.
yeah, 0 out of 5.
Before December 25, 2006, my CPR rate is I have revived around 72 patients out of 72. No patient died on my watch before December 25, 2006. During December 25, 2006, a lot of a lot of people. Sorry, not December 25. My first mortality was August 20, 2006. My first mortality in CPR was August 20, 2006. Then the next was December 25, 2006. Because from August 20 to December, I didn't have CPR because we were in communities. My first mortality is my grandmother. Yes. You cannot tell me that I know how hard I I should not be biased in doing CPR to a member of family. But who will do the CPR if my grandmother is at home? Am I right? And that happened when I just went home from my class in community. Then when they opened the gate, my grandmother's caretaker, I saw her eyes really swelling because of crying. Then I said, "Oh, I know what happened." I ran to my grandmother and did the CPR. So I'll ask you, the two of you, before you sit, how are you? Then December 25, 2006, when I called that, I was on a 24-hour duty. I called that the Bermuda Triangle. Why? There's only 3 beds where all patient died. And those are all 38 patients who were in that bed died. Cannot forget that day. And there was one patient who came in just for 24-hour observation. And I was asked by the resident to put a, what do you call that? NGT. When I was putting the NGT, he was saying, then when I put all the NGT, I checked his vitals, no pulse, not breathing. I did CPR. Yes. I cannot forget that really, that date, December 25, 2006. It's a, how would I place that? How would I define that?
Canada.
It's a massacre. Wherein really there's a lot of patient died. Okay. Understanding the medical and legal aspect in critical is critical in practice. Why? You need to know or fill up your death certificate correctly. I told you, don't tell me that the cause of death is cardiorespiratory or cardiopulmonary arrest. Please, please, again, please. I don't want you to write it down like that. The cause of death is what killed the patient. The patient will really die if you have one. No patient will survive in a cardiorespiratory arrest. A patient drank poison but was in the ICU for 2 months. Then after that, the patient died. Can you still blame the poison for the cause of death? Can you say the cause of death is poison ingestion? After 2 months, the patient died. Yes.
So it depends, because if it was acute poisoning, there's a duration.
Again, 2 months.
2 months, so.
I gave you the duration.
Yeah. So again, if the poisoning led to hepatic failure, but then again, it would be hepatic failure, secondary to poisoning.
Okay, no hepatic failure. Can you still blame the poison?
Because that was the original insult.
Mm.
That was the original insult that led to.
Yes, I agree, but there's no hepatic damage.
Was it a hospital-acquired infection?
Can be. See, patient can die even if they drink that poison. Then after that, they die in the ICU, right? After 2 months, it cannot be the poison to be blamed. What really caused the death? If the patient is with fever and the WBC is high, might be what? Septic shock. Definition of death, cessation of life, what you said a while ago, in a previously living organism. Cellular versus somatic, you have discussed it already. Cellular is internal, somatic is external. And there is what you call ethical, cultural, religious debates, the influence of death. May I know the cultural here in Fiji when someone dies? Okay, not in Fiji first. In religious, Muslims, what happened when there's someone died? All death. What do you do? Right? You need, yes. Bury them before or after? What? Yes, but what are you, what is the timeline there? Why? From what I know, before sunrise or sunset, right? Before, am I right? Before sunrise or sunset? Yes. From what I know, it's before sunrise. You know why? Do you know Dodi Al-Fayed? Anyone knows Dodi Al-Fayed? Yes. He was the one sitting beside Diane. And sunrise is, I think, less than an hour when he died. He was buried as soon before the sunrise. And as you know, we have a lot of Muslim students, right? And some of them will message me, Doc, I'll be late for class. I'll morning, before sunrise, we'll be burying my. Yes. Okay, I understand. That's one. Cultural. What's the cultural way here? In the Philippines, cultural, the body is here while they're having the wake. Here in Fiji, I have noticed the body is not there. It's just a picture. The body is still in the morgue. They will get the body in the morgue once they need to bury. That's cultural. Oh, now I remember who you are. You're the COVID babies. Am I right? Okay. What if someone died of COVID? They need to bury it. Actually, not bury, sorry. Cremate. That's in the Philippines. I don't know here. Because I heard they are burying those who died of COVID. Yes. But remember this. That's why they need to burn it, to cremate it, because the infection will spread on the soil. You understood? But then again, we need to follow the cultural practice of each country. I think you know why I'm doing that, right? Cellular death occurs in cellular metabolic process ceases. In short, there's no exchange of oxygen. There's no more adrenaline coming out from your body, from your endocrine gland, and so on and so forth. Different cells die at varying rates after somatic death. Which one dies faster? Which one dies the fastest? What cell dies the fastest? Guys, I still have the, what do you call that, problem in my ear during the flight. So can you speak a little louder? Nerves? What nerve? What nerve? The brain, not the nerves. Glial cells. What do you call brain cells? Neurons. And skin and bone remain metabolically active and longer. I think they did the exhumation before to a person who died. Then they saw the hair. Yes, it's still growing. Somatic death, defined as the irreversible loss of consciousness and environmental communication. In short, they what? They don't feel anything else. Brain death criteria adopted in UK for diagnosis. There is a criteria for brain death. I would like you to research it. Why do you need to research brain death? or dead. What do you mean by brain dead? The brain is not working anymore, right? But you can still have the heart beating and the lungs. They are still breathing. Advances in resuscitation have shifted survival outcome. What does it mean? If you can do a good CPR, right? Prolonged disorders of consciousness. This includes what? Coma, vegetative state, and minimally conscious state. Let's define the three. What is a comma? When you write series of words, right, you put it in between of the words. Am I right? You want a serious lecture? Let's have a serious lecture. You don't want me to crack jokes. Yes, I told the year two. I told the year two. If I crack jokes and you didn't laugh, I'll give you an exam. Ay, where's Sushmita?
Alright.
If you crack jokes, if I crack jokes and you didn't laugh, I'll give you an exam. If you laugh but I did not crack a joke, I'll give you an exam. Okay. Comma. What is a comma? What do you mean by unresponsiveness? What do you mean by unresponsiveness? No, no, not state of paralysis. No. RE movement? No. No. Motor or reflex
So,
or muscle movement. And no. And what am I referring to? When do you use GCS? Where do you use GCS? When do you use GCS? Okay, I'll have a question for you. Read the internal medicine book. It uh, it doesn't mention anything about GCS. Read the surgery book. It mentions GCS. The question is why?
anesthesia.
When do you use GCS?
Neuro-
Hmm?
neuro-
To assess the state of consciousness,
When?
when a patient
Patient presents during unconscious or sedated.
When?
as soon as you see the patient's
Actually, you in your time now, it's in the internal medicine. During our time, it's not in the internal medicine. Why? GCS is used only during accidents. Have you noticed
Trauma.
that? Trauma. And when we mention about internal medicine, this is mostly not trauma. That's why it's mentioned in surgical. But give me one trauma in internal medicine. Game. One trauma in internal medicine. Five, four, three, two, one. You panic. Five, four, five, four. What do you do with trauma? Even interpret medicine. Ay, internal medicine. 5, 4, 3. Internal medicine is not a Five. Start up on this. I feel like GCS is a person being very punctured. Four, three, two, one. Five, four, three. It's good. I don't like to hear TIA because TIA is different. We have a different meaning of it in the Philippines. And it's not good.
Oh, okay. Transient, just give it a 10. Yes, I know that. And if you answer,
No, it's not TIA. It's the
true.
when a person wants to smoke, that's the only no because it will rupture your blood vessel.
For Andrews.
Yes.
Okay. I will do that section. Thank you, guys.
I want.
Or that's the only.
Okay, so
I want.
No, no, no. Can we just 1 to 2 minutes? We just haven't got very long since I arrived here. When we will remind of the snow. No, because last October 3rd, some of you know, my mom had a stroke last October 3rd. I told him that I'll be going to India, but I didn't. Told her that I have returned already. So you use GCS, those things, for comma. What is a vegetative state? Yes. Then minimally conscious state, but once there's no stimuli, they fell asleep again. So which one of you during lecture? So you're laughing, it's true. Am I right? Which one of you in lectures does this? I've been in this state during lectures in medicine, especially coma state. No, coma state when I was on call. In the Philippines, when we are on call, we sleep in the hospital. And the nurse will wake us up if there's a problem or we need to give medication. The schedule of the patient's medication was 3 a.m. And I'm the one assigned to give the medication. 2:30 a.m. the nurse went to our what do you call it? Quarters. Woke me up. Doc, can we give the medication early? I said, yes. Okay. Nurse went out of the quarters. I'm still sleeping. 3 a.m. Doc, the medication is due now. Can you give it to the patient? Okay, I stood up, opened the door. I asked the nurse to go out. I closed the doors. This was the story of my co-interns because he didn't know that I did those two. That's 3:30 a.m. We're late now for the medication. What? What medication? I woke you up twice. No, this is the first time. So what I did, I went out, went to the nursing, and offered the medication, gave it to the patient, went back, and my pointer was saying, the nurse really woke you up. That's the third time. You stood up the second time and closed the door for her. Okay. So what's your fault? Right? One, two, and three. There are times that some of us, when we are really, really tired, even pain sensation cannot wake us up. Right? Permanent versus recovery, highly improbable decision may involve ending life support. Should you end the life support? As a doctor, should you end the life support? Yes. Yeah. It's an answer of a yes or no. As a doctor, should you end the life support?
If it's the,
As a doctor,
yeah,
not the family's decision.
if it's okay to contribute,
Again,
if it's like allowed in your contribute, and if you have the,
allowed in our family.
like Fiji doesn't allow that. We do sign the,
What's my answer? Man, I haven't decided on my patients are dead. But seriously, if I'm in that situation, no. As a doctor, as a family, if they are doing the CPR now for more than 30 minutes, I might ask them to stop. That's what happened to my dad when I learned that they were doing CPR now for more than 50 minutes. When I was talking to my youngest daughter, I was here at TV. I was talking to my youngest daughter. Ask who wants to decide. If you will be asking me stop sleeping, there's nothing. I rather have them like court rulings allow ending life support without legal permission if family and doctors agree. Yes. If it's not allowed in the country and it needs to be stopped because you're just using up. The big question is when should you decide when to stop the life support, the ventilation, the medication, everything. When should you stop? No, you're not doing CPR. You're just giving life support. Let's say the patient is in life support for 2 years. Oh, no, that's too long. But we have a case, life support for 2 years. Father doesn't want to stop. A month of life support. Not a month, a month. My question. When should you stop a life support after a month? You're the family.
It doesn't
A
come
month. The patient agrees, the patient doesn't agree because the patient is in coma or state. How would the patient still?
that healthcare provider, the immediate healthcare provider.
Among is, that is done everything and still among 1 month. That is the on the family and the sponsor. So there should be no problem.
Depends on the condition. If the patient is not responding, or there's no changes for a month, chances are you explain that to the patient. I have experienced one of them. It's just a month. The doctor now is explaining there's no improvement. We don't want you to waste resources, working your resources because you're buying the medicine. We'll, we, we can still prolong, but if you want, we can now discontinue the life support. So family meeting. After that, they decided to discontinue the life. It is the family who's turning off the life support, not the doctor. Okay. Now, question. After they switch off the ventilator, the patient is still breathing. What will you do? Let's see how well your ethics and basic professionals.
Our patient is still basically they're not content.
Yeah.
So we will start on them. But we wouldn't do the we wouldn't start time because they're breathing on them. They will just take care of the patient, and if they deteriorate, then we will not actively kill the patient or euthanize it because it's
So start after I was
Yeah. What do you do?
continuing with the health and also when it was switched off, whatever was taken off, it hasn't documented. So permission was given. That's there as a
None.
but yeah, we some conditions out.
then, but not big one there.
Again, I don't answer the questions of the patient. The patient is still for the pure we already when to switch off the ventilator, when the family switches off the ventilator, there are a lot of personnel. Except the time when the young people take off the switch and target their phone. When you ask them to switch off the ventilator, they need to sign. Now, there's spontaneous ventilator and breathing. Explain it to them that there's spontaneous breathing. The patient can still survive, and that's it. We didn't see the spontaneous breathing because they were in a ventilator. But now there's a spontaneous breathing. Explain to them that that's an improvement for the patient. Do you want the ventilators to switch off, but in the long run, the lungs will get tired? Or still continue to ventilate? We can switch it on and let them start whatever their decision. They signed that would be the ventilation because there was an improvement. What if it's 2 years? No improvement, no deterioration. What would you do?
Advise the patient's family about the status and give them all the information they require about how long, because that this will continue until and unless you take them off life support. So again, it's an informed decision from the family. So you have to.
That's what we're doing now. Not 2 years less than. Depends on the hospitals. Tissue and organ transplantation. Does Muslim have transplantation? Okay. Before we continue with transplantation, this topic, what's the most common tissue being transplanted? Again, what's the most common tissue transplanted?
Oh, tissue. Yeah, of course, I say this is tissue.
I smell it's
It's the
I don't smell it's one. That was the one I was smelling, so I could see a weight coming my neck over. Because did you know what's my phobia? I fell asleep in the airport, then the plane left. Is that the issue? Is blood a tissue? Is blood a tissue? Are you sure? You're willing to bet that you will be picked and will be figured out? Is blood a tissue? Is blood a tissue? Are you sure? Are you willing to bet to fail in F when you're wrong? That is, it's a special tissue. And it's a specialized connection. So the most common transplanted tissue, I didn't say organ, is. Thank you. You still remember that. I told you that during third lecture or fourth lecture. Oh, you forgot that. Yes. Again. No, the definition of tissue, most of you will think tissue is a solid. organ, right? Or solid thing. But blood is a specialized connective tissue. It's a liquid connective tissue. So, global laws influenced by religious and ethical perspective. Why? There are some religion doesn't want to have a transplant, especially blood, right? And what religion is that? Jehovah's Witness. What if you transplanted the blood to a Jehovah's Witness? Can you transfuse blood to a Jehovah's Witness? Yes or no? Raise your hand if you said yes.
You can, technically, physically you can, but then the legal implications.
Yes. Yes, but it's complications.
Patient is on transfuse.
Okay.
What if there's no family member? I said blood product is all not also allowed for Jehovah's Witness. What do you call that? Expanded spirit.
Yeah.
But I give you my experience. Postgraduate intern, we are vehicular accident. Patient was losing blood. We check everything, nothing's there. So, because the patient is losing blood, for the best interest of the patient, me and the ER officer decided to give blood transfusion to the patient. After 4 hours, we found the social service found the family and the family there. And they saw there's a blood transfusion. They asked us for blood transfusion because there's a Jehovah's Witness. And we are being so and asked that we haven't seen anything pertaining that he's a Jehovah's Witness. For the best interest, we seen the patient who needed to give blood transfusion. We went to court for him. We went to court. And the court dismissed the case because there's no proof during that time that the patient was a Jehovah's Witness.
Then they have a mandate that as a card.
Yes.
Or
But the problem is, I think during the vehicular accident crash, the wallet was not misplaced. Taken.
taken out.
Is it personal? Now, this is the second one. We know the patient was Jehovah's Witness, but the patient really needs blood. We transfuse blood. We believe that we will be punished or not. How did we transfuse blood? That's a question. Go back to the first premise before this slide. We asked for what? Ah, judge. We asked for a judge to allow us.
It's usually a judge at, like in big hospitals, they usually have a judge appointed.
So we were not charged because we are there for the best
Beneficent.
yes, for the beneficence of the patient. Just remember this. If you know your job really well, you can act even if you think here. Did I ask you the question? Who should you think the mother of the child? That's one thing. Then that night, when I visited my Facebook, there was this that question again, and I answered, but who are you to choose to be for that? You are not allowed to choose who lives for that, even if you are a doctor. Unless you are allowed to choose who lives. In your, what do you call that? Hippocratic are we clear? Never ever choose. Always say all. If you didn't say all, I think you say one. Why did you switch that off? Is it cold? Do I look like cold? Do I look like cold? Now why did you switch it off? You didn't switch it off. No, no. Please. Switch off. 28. Then let's go on to have the lecture. Human tissue authority in the UK oversees organ donation consent. Sources include live donors, cadavers, and xenotransport. So live donation requires strict protocols to prevent exploitation. What does it mean?
Organ harvesting. That's not.
There is what you call a black market. And there is also what you call some people donate blood just to receive money. Am I right? Cadaveric donation regulated by opt-in and opt-out system based on the country. In our country, the Philippines, we test first the blood, but we get the organs now. But we need to test the blood. Why? What are we checking? Two things. Infection. Would you like to receive an organ with infection? Okay. What's the second one? No, ABO compatibility is checked when it will be transplanted. When we will be deciding that organ can be transplanted. Again, organ, eh? No, you test when they match when the organ is decided to be transplanted. Can, but there's one. Can I go to Google? I'll give you 5 minutes to think.
Is the organ moving like into the normal function? Because that's the thing they need. The main function.
Okay, what's the answer?
Malignancy. Malignancy.
Yes. If the person has a malignancy, will you receive an organ if the person has malignancy?
Very disciplined.
What if the malignancy is cervical cancer and it will be transplanted to baby? Now, it's not a good question. That's a big question. Should you receive it? It's a cervical cancer. Will you receive it?
What are the consequences?
Liver.
Liver.
Will you accept it? They didn't mean a cervix. Mean a cervix.
Yeah.
You want me to touch your cervix?
I'm like, oh, yes. Yes.
What's this?
Yeah. It's so good. Yeah.
But I agree. If there's malignancy, they won't allow them to come. In the first place, they won't give it to you. If there's malignancy, genetic problem, I haven't heard any tests in the transplant. What else? So those two, infectious and malignancy. Actually, that malignancy, even this tumor, yes. And that's a bit
That's
after after harvesting milk tested,
it's to just the viability of
yes.
it.
Tissue, what do you call that? Tissue typing, blood typing, MHA typing, MHC typing, HLA typing, those things will be done after they said this is good for transplantation.
Like say for example you're doing a heart transplant, will you do an echo before?
Can you give the statement, called a complete statement?
Say you're doing a line so could I have that nation?
Okay. Go.
So say for example you're doing a bad dissection, transplantation. So would you check the heart's viability prior to harvesting? Like say bronchoscopy or even if you're doing a lung bronchoscopy.
Of that heart,
Of that
being
heart.
transplanted?
Yeah.
Yes.
Prior.
Prior. Why? What if there is now a telesclerotic plant? They do it. They do it. But that is after the two things that they checked. That's the third thing. But normally, if the patient is around 80, they don't do it. What is xenotransplantation and cloning? Xenograft, potential solution for organ shortages concerning remain about tissue matching and virus transmission. What is xenograft?
Basically the word itself means alien, so it's foreign to the patient. So
In
it's
short?
anything other from the patient. So a transplant or a graft that is not homologous or analogous to the
In short,
animal. Bovine, animal.
what is the most common tissue transplanted to an animal to a person?
Bovine, porcine, heart valves.
Yes, the heart valves. Now we go now to the bovine. Will you accept a bovine heart? It's your but I asked one Muslim in Philippines who has said, I that this is my this answer. He did not give me an direct answer. Okay? But this is his answer. This is the answer. It's not in your program anything that we should accept or not. What is your partner is your privacy. But I will accept your opinion because how you interpret it. There are some Muslim uh, cashiers when we buy a new word port, we understand them. So we have the port on the scanner, and we're the one who put it in because some of them uh, think that they should not also hold up such, which understood. Understood. As I told you, and we accept in that opinion because if different people have different opinion. The only thing that it said in the Quran is that told me was you should not be eating. And this is my question. What if you went to a land that it has only for and women, and you would be staying there for 10 years? You know the answer. Yeah, their answer is in that is his first answer. After you leave that country, it's like I forgot what you will be doing. You need to do something to cleanse again. Something like that, from what I understood. Yes. Yes, something like that. Because again, let's go to the first premise that in your religion, it's not given that you should die because of you did not eat. So, but different has been answered. Wherein it will accept a porcine ball or not. But then again, we respect that. Cloning. Should we do cloning? Is cloning it? What if I clone you? Huh?
That's not ethical.
But that's not okay. But that's okay, right? There's a lot of man.
No, cloning is currently it's not being approved by the like you can grow ovens, but then again, if that's in the specification, like you can grow an ear on a rat. As far as complete humanoid cloning is illegal. In Chile.
Did you know that when Albert Einstein died, his brain was divided into 6 parts, and it was given to six, like 56 museums, something like that. And one museum lost it. Did you know that?
And you don't want to remind that it was lost.
Rumor has it that they are cloning Albert
It is feasible. It's possible. You can clone the cells. It's very easy. But
there is what you call a conspiracy theory. they are waiting for four more to die. I guess because they have six. Out of it, Napoleon, Albert Einstein, I forgot that. And they're waiting for four. Oh, sorry. I don't know if COVID was included. And Michael Jackson. Because they were planning to clone and make it one person.
It's really defined the future.
Yes.
That's plain God in itself here.
That's what I said. You are not. You are not. Do you agree? Did I ask a question?
Yes.
Then keep a statement there. You are not. You are not God.
Really insecure.
So please, when you have a son or a person, please don't name them God. So I can still say you are not God. Are we clear?
Have you seen the Keanu Reeves movie when he cloned his family after they died?
That's not Keanu Reeves movie. That's Arnold Schwarzenegger.
No, I'm not talking about
That's
that before.
6 day.
No, I'm not talking about this day. This is another one. It's Keanu Reeves. The it's an AI one as well.
With whom?
What the girl's name? It's not
Sandra
really,
Bullock.
no.
Because chances are, when you say Keanu Reeves,
You're thinking about
Sandra Bullock.
He's
No,
all
no. Because they have three, four
movies, yeah.
movies.
Speed and no, I'm not talking about it's even a more older one.
I'm too young. More older one, I cannot. Let me the title of the movie. It's the first time I flew without watching anything.
Replicas.
What do you? What's about the replica?
I've seen it. It's like
I've seen. I have read.
it was talking about cloning family members. So his family dies in an accident, and he is an AI slash bioengineer. So he clones his family with his memory. So like it's very sci-fi, but I was just asking something like that is like definitely not what it is.
It's not because cloning. For example, I want to clone a man. How old?
Did you mention it?
How old are you?
Oh, 23.
23. It needs 23 years to appear like him. Yeah, that's good. That's good. That's what is not said in the movie. In the movie, when you float, surveillance engineering. That's not cloning. That's bioengineering. Yes. Cause of death. The cause of death certified using an international standard format, divided into part 1, condition directly causing the death, and part 2, contributory condition. In short, for example, what's the cause of the person's cardiorespiratory illness?
Emma.
Okay, MI. Let's go to MI. What causes the MI?
Ischemic attack. Ischemia.
You just defined it. I'm asking what caused the MI? Could be diabetes, hypertension, those things. You understood now? This is what you call the death certificate. Need for improved oversight to prevent malpractice. And the improved oversight is what? People, doctors writing their cardiorespiratory arrest. Even if you don't know, please don't put cardiorespiratory arrest. So in conclusion, the medical legal aspect of death encompass medical, legal, and ethical issues. Yes. How do you define ethics? How do you define ethics?
It's a set of principles and rules with which it guides the person's actions.
At the end of the day, you can still sleep soundly
You,
because no one is guilting you that you did that. But how would you know what is right and what is wrong? Because in my experience, it's not because everyone is doing is right and you're the only one doing it, it's wrong. You understood what I meant? How would you know if it's right or wrong?
gut instinct.
Ah,
Gut instinct.
then you say it's luck, right?
If you make it by a set of principles you live by, four moral values, and also uh, you can ascertain that whatever action you've taken or undergone uh, is morally correct.
Yes, it's the moral. Collaboration among professionals ensure accurate and determination and ethical management. Actually, this is the reason why there is what you call a morbidity and mortality, a conference of doctors, and morning rounds with all the doctors. Why? Because you're discussing if you did the right thing or not. You understood? To tell you frankly, we're not yet in the core of forensic. This is just the core of being a doctor. Do you agree?